What is chronic fatigue syndrome, or CFS? Chronic fatigue syndrome is a complex chronic disorder characterized by extreme fatigue and isn't typically relieved by rest. The cause is not explained by any underlying medical condition. People with chronic fatigue syndrome are frequently unable to perform their daily activities. In some of the worst cases, some are confined to their beds. The condition affects millions of people all over the world. Although it affects both children and adults, women appear to be affected the most. There is no known cure for chronic fatigue syndrome, primarily because the underlying cause can be different from person to person. However, many people have resolved their condition or significantly reduced their symptoms by employing several natural solutions. Chronic fatigue syndrome can last anywhere from months to years, especially true when no action has been taken. There are a number of factors that are associated with this condition. Causes of chronic fatigue syndrome. The exact cause of chronic fatigue syndrome is unknown to each individual person. However, research has shown many contributing factors to this condition, which includes viral infections. Some people develop chronic fatigue syndrome after they had a viral infection. Therefore, some viral diseases can trigger chronic fatigue syndrome. They include HPV and leukemia, among others. A weak immune system. Many people with chronic fatigue syndrome have a compromised immune system. Hormonal imbalances. Studies have revealed that many people with chronic fatigue syndrome experience hormonal imbalances. This imbalance causes abnormal production of certain hormones that affect the body's proper function. And of course, stress. Stress has been associated with chronic fatigue syndrome. Most people with this illness suffer from depression and anxiety. The symptoms of chronic fatigue syndrome will vary from one individual to the next. The symptoms will also range in severity. The most prominent symptom will be fatigue. A frustrating factor for many is that the fatigue doesn't get relieved by rest. This results in noticeable decrease in one's activity level. Episodes of fatigue can last for months or years. Other chronic fatigue symptoms might include sleep disorders. People with chronic fatigue syndrome may experience sleep disorders such as insomnia, hypersomnia, restless legs, night sweats, light sleep, fragmented sleep, or a lack of a refreshing sleep. Pain. People with chronic fatigue syndrome may experience different types of pain, such as muscle pains, headaches, joint pain and swelling, sore throat, swollen and painful lymph nodes on the neck and armpits. Cognitive impairment. This can range from memory loss, reduced concentration, dizziness, numbness, panic attacks. And there are additional symptoms. These are other symptoms that some people may experience. Anxiety, depression, flu-like symptoms, body temperature changes, stress. Diagnosing your chronic fatigue syndrome. Diagnosing your chronic fatigue syndrome can take time. The symptoms can mimic other medical conditions. Doctors must rule out all other illnesses in order to diagnose you with chronic fatigue syndrome. Be sure that you see your healthcare practitioner if you've experienced chronic fatigue or any of the above symptoms for more than 6 months, and if you do not feel refreshed after sleeping. Chronic fatigue syndrome affects many people, most of which are unaware that they have the condition. It's important that you understand all of the symptoms, inform your healthcare practitioner of them, and review your full health history, including any medications you may be taking. It should be discussed. It's important to be thorough, as any missing information may hinder your ability to uncover the underlying cause of your condition. This can lead to depression and a restriction of physical activities. Here are some natural solutions for chronic fatigue syndrome. There's no specific cure for CFS. However, there are various natural solutions that patients use to eliminate the symptoms. In some cases, even resolve their condition. It's always a good idea to discuss your natural approach with your healthcare provider. Firstly, cognitive behavioral therapy. It's a treatment that involves helping patients manage their CFS. The therapy focuses on helping one accept the condition, be able to manage the symptoms, and change their attitude towards the condition. This will allow you to gain a better understanding of how to overcome the symptoms. The treatment is offered on a one-to-one basis, hence, you need to have an experienced practitioner. 2. Physical activities. The best natural remedy for CFS is physical exercise. It's especially important to engage in exercises that raise your heart rate. Exercises such as swimming, walking, and climbing stairs should not add to the fatigue you already have. Always start with just a few minutes of exercise and gradually increase. If you lack confidence or are unsure where to start, consider consulting your healthcare practitioner or personal trainer. 3. Make lifestyle changes. Lifestyle changes involve resting and relaxing more. If you are facing difficulties with sleep, stress, and pain, you should rest and relax during the day. But make sure that you don't sleep too much during the day. And 4, decrease the consumption of caffeine and alcohol. If you have chronic fatigue syndrome, you should eliminate caffeine and alcohol. This is especially important for those people who have difficulties sleeping at night. Chronic fatigue syndrome is a condition that affects many people. It's important to understand the causes, symptoms, and how to treat it naturally. Working with a healthcare provider will help you recover faster. You're one step closer.